Does melasma ever go away on its own? In general, I would say no. The reason is because melasma is a multifactorial skin condition, and most of these factors that affect or worsen melasma never ever fully go away. We know that most melasma patients have a genetic predisposition, and of course we know that genetic predisposition never ever goes away. Other secondary factors that could worsen melasma, for example, things like sun damage. In tropical Singapore, it's inevitable that we do suffer sun damage and accumulate sun damage as we go along. So this never really gets any better. And of course, the next factor is hormones. During periods of hormonal stress, severe hormonal fluctuations such as pregnancy or even menopause, melasma does tend to get worse. And sometimes transiently after the hormonal stress or fluctuation is over, melasma does tend to get better a little bit, like for example after delivery. But in general, as we get more and more exposed to these hormonal fluctuations over a long period of time, melasma of course tends to worsen. The third factor is skin aging. Skin aging is something that happens all the time. We can of course do some treatments to reverse skin aging or slow down skin aging, but it's an ongoing process, and of course melasma does gradually worsen as the skin ages. The last factor is concurrent skin conditions, so skin pathologies such as sensitive skin, rosacea, eczema. These also tend to worsen melasma over a period of time. Of course, when we treat these concurrent skin conditions, we can slow down the progression of melasma or sometimes reverse a little bit of the melasma process. But in general, I would say if you were to leave melasma alone, it never really goes away by itself.